The third part of our surgery navigator and the last part that we need to interact with would be a similar workflow to PACU to discharge, except this would be, of course, if you're going to keep the patient inpatient in the facility, and rather than going to a discharge or external location, we're actually going to send them to the floor. The first two pieces of that Navigator tab, the brief op note and the op note, function essentially identical to what we saw in the PACU to discharge piece. All of that functionality is the same. What is a little bit different is the orders reconciliation piece, and you'll notice a couple things differently, a couple things that are different about it as we look at it here. One of them is that we actually have a little bit more that we need to interact with up at the top. And that's because Epic will be looking for you to be a little bit more in depth with your orders as far as what needs to happen when your patient has gone to the floor. So there's actually a little bit more interaction that needs to happen here. The first piece of this is very similar to what you did before, which was to look at the prior to admission medications and make some decisions about what you want to do with that. Now, to make sure that we can interact with that right, what I'm actually going to do is just go ahead and add a prior to admit medication. We'll just say aspirin. And obviously this would often be done at this point for you because this has been, you've reviewed these before you got started. You have to interact with the mark as reviewed. Same thing as we looked at just a little bit before. And then when you hit next, or you can click right here on the number 2, either one will work. This is going to ask you to determine whether or not you're going to order this for the patient to continue this medication on the floor. Replace gives you the opportunity to make some new instructions about it. So the medication will be either replaced or continue with changes, and then you can discontinue it altogether. You've already reviewed a little bit about what you can do in the upper right-hand corner here. Again, same functionality, find the unreviewed, and then use a bulk discontinue for anything that you haven't addressed. So decide to continue what you want to continue, then use don't order unaddressed to discontinue everything else. When you click the advance arrow, then you're going to get the review current orders screen. And this is sort of the same thing, except instead of now looking at what the patient came into the hospital with, we're going to look at the orders that are currently in existence and determine if we want those to continue or discontinue on the floor. Functionality is the same as what you saw in the past as far as the ability to do a continue, discontinue, or modify the order. Discontinue unaddressed, find reviewed the same. So let's see what we have here if we say continue, discontinue, and then a modify. So modify is the one that brings us up to the box where we will actually make some changes to that particular order, and then you can add any other information that you need to add and hit accept, and you now have an order there. You'll notice that review current orders remains incomplete because we continue to have some that didn't get addressed. When we click on that red bar over here, we actually get Epic telling us the ones that we still have to interact with. So let's say that you want to discontinue those. We can hit discontinue. You'll notice that our hard stop over here in the shopping cart clears and allows us to move forward. Order sets will be something that we discuss in a little bit more detail, but let's just take a quick look at how that will roll out for you here. So order sets are collections of orders that are sort of logically placed together. So let's look at the general admission order set. It's a good way and a huge time saver for you to be able to order multiple things at one time, particularly those that are fairly standard for you, without having to go onesie twosie and enter these orders individually. Now, knowing that there are some orders contained within this set, so you could think of an order set as a container that holds placeholders for orders. And when I say placeholders, what I mean is you still will have some responsibility to interact with the individual orders in the set. You won't have to call them up individually, but there will be some places where Epic is looking for you to provide some additional detail. So you'll notice that what we have here is actually to either open the set or just clear what we have. So we'll go ahead and click Open the Order Set, and we'll be able to look at some of the things that Epic wants you to interact with before we actually close out the orders that are contained in the set. Same functionality as before with the red or the red stop sign with the exclamation point telling you what you need to work through. So each of these that we're looking at here are the different orders that apply inside the order set. Some of them are defaulted, and you can change these defaults. It's something we'll get into here a little bit later. You can change these defaults for these orders to the things that are common for you. If you have the need to change or want to change the things that you've defaulted to, no issue there. You can simply click on it. It'll bring up the window, the order window, where you're able to make those changes. Then you'll see where we actually have places where Epic is sort of hard stopping us because we need an answer to this question. So in the urinary section, obviously, no catheter present or an order associated with it. So when we click one of those, then Epic clears our hard stop and allows us to continue down. We can add in other things that we need. If the order can be entered exactly as it is without further interaction, that'll happen. If not, we can come, Epic will pull up the details screen, give us the stop, and allow us to make some entries and move from there. Stop here to ask about what we got going on with that, since I don't know. And then lastly, over here, same options as in the previous Navigator piece, remove all, which is to clear our shopping cart, save work. Let's keep what we have in our shopping cart without buying it, and then sign and hold. Sign and hold is, again, something we'll talk about a little bit more in depth. This is how Epic keeps track of where the orders should be performed. So you'll notice here that your only option is sign and hold, initiate orders on arrival. Obviously, what that's doing is that's just being clear that the orders you have in your shopping cart up here are not orders to be carried out in the PACU or in the unit that you're in. These would be the orders that would be carried out on the floor when your patient gets there. So when you sign and hold orders, that's simply putting them in and allowing the nurses on the floor, receiving nurses, to access those once the patient arrives there, and then they can release, what's called release those orders, and begin initiating them. So that wraps up the Surgery Navigator, and we will look in more depth at some of the things that we saw here, including orders, a little bit more about orders and ordering individual orders by themselves, not connected with an order set.